Hi everybody, so we're going to be coming back now. So we're going to be doing the panel discussion. So I've got a few questions that I'm going to be asking our lovely panellists before they will introduce themselves. And also you guys will also get a chance to ask any questions at the end of the discussion. Any questions that you have of your own. It will be kind of really helpful. I would encourage that you all kind of do try and ask a question, because I think this is a space for us to actually learn from each other. Also wanted to kind of give you a little bit of background about me, because I think throughout this I've been kind of telling you a few stories. But another story as to kind of why Good to Me was actually founded was because so I started working in mental health because I had a big interest within mental health, also especially after my father experienced a stroke when I was quite young, and then also experienced quite some depressive symptoms as well. That's where my passion came from, and I was quite eager to find out more, especially coming from a kind of black ethnic a minority group. Often we don't talk a lot about mental health, so it's very much a taboo subject, and I wanted to work in the field, one, to help people, but also to be able to be somebody that people will be able to relate to as well, because I'm not too sure, but I currently work in that sector, and there is a lot of people who are in kind of maybe sectioned or in hospital who are coming from a black ethnic kind of background, and I think it's important that we are able to be out there and to support them. So another story basically was that when I started working in mental health, so I started out as a support worker, working on a female acute ward, and I was very eager to help as I am, and that's how I've been brought up, which I love that side of it. But I've also learned that sometimes if you are doing too much of the caring and you're putting yourself first, you can definitely put yourself in danger. So from working in mental health, that's where I kind of learned that I also have to definitely put myself first. And I remember kind of running through the corridor, and there was a lady who was quite upset at that point in time, and I was just trying to, I don't think anybody was, she was banging on the office door and nobody was paying her any mind, so I was trying to run up to her to help and see what she wanted, and all she did want was her credit to be topped up, and which got done in the end. But I think my supervisor at the time, she kind of stopped me and said, "Shanley," because I think she could see how I was running around the ward to try and help people, but that's when she kind of stopped me and was like, "You need to be careful before you burn out." And that's when I think I was quite offended at that point in time, because she said, "You need to make sure you're practicing self-care," and I was really offended at that point in time, and I was like, "What do you mean?" But then I went home and I did a bit of reflection, and I was quite stunned that I knew what self-care was, but I didn't actually know what it was for me. Okay, so I think a lot of the time when you might see on different platforms and websites, you might hear about self-care, and so you might think or associate self-care with having lovely baths and lighting candles and putting on face masks. But I believe that sometimes that's not what we need all the time. Sometimes I think, I've done a workshop which is all about the basics of self-care, and we just talk about going back to basics, just the simple things like getting enough sleep, making sure that you're eating on time, making sure that you're having connection with other people and you're not isolating yourself. So those are sometimes the things that we can often forget and let that kind of slide, and then that's where mental health can be impacted. So my main message is that we can do things to actually improve or maintain good mental health, and it's by doing these small things like maybe connecting with other people, trying to learn something new. We know that how the big benefits of kind of exercise and what that does for us, You might not want to go and do a 5k run, but you can have a little dance in the kitchen or wherever, which I did yesterday, which was really great, which was quite helpful. And you can also just be a bit more mindful. So what we did just earlier, where we did the kind of mindfulness session, doing those kind of things. And I just want to state that we have YouTube, and I think YouTube's amazing because I've learned a lot on YouTube, and we can just simply go on there and, you can put on a 5-minute mindfulness meditation, etc. And you've been introduced to that today, so I do encourage you guys to do that. So I've got some questions for our lovely panellists, but I'm going to allow them to introduce themselves. So would you like to introduce yourself? So I want you to introduce yourself to us and let us know your name and what you're currently doing at the moment.
Hello everyone, my name's Lizzie. By day I'm an estate agent and in my spare time I compete in Miss England, hence the crown. In case you're wondering, I'm not a real life princess.
You are.
Hello everyone, I'm Stevie and I do YouTube and social media bits.
Hi, I'm Penny. I'm Penny and I'm a business development manager by day and a mental health blogger aside from that.
What's going on? I go by the name of Shock and I'm a recording artist, and now I've kind of somehow transitioned into like a mental health advocate as well.
So my question for each of you is if you could briefly tell me about your mental health experience, okay, and what self-care is for you.
Briefly, yeah.
That's what I was just thinking. How do I do that?
Okay, so I've suffered quite badly with anxiety and depression for quite a long time. Probably started to realise when I was about 12, 13, went to boarding school, not easy. Ended up having to leave school because of it. And I was a smart kid, I was doing quite well, but had to take quite a lot of time off school. Basically ended up ending my education at the age of 16, 17. And I was in and out of hospital. They didn't know what was wrong with me. I was having really severe panic attacks, which I didn't really realise what it was until about a year later. And it could be up to 5 or 6 times a day. I was in hospital, ended up on a psychiatric ward, a children's psychiatric ward. And I think at the time there was still this massive stigma and not a lot of understanding, especially for children with mental health problems. So I ended up going to a private clinic because I thought that was the only way that I was going to get a diagnosis. And they diagnosed me pretty quickly. And I'm not 100% sure if they were accurate to this day. They diagnosed me with bipolar. And I didn't think that bipolar was something that I would be able to ever manage without medication. But after, it's been about 6 years now, 7 years, how old am I? And I've been off medication for 3 years because I've learn how to cope with it. I know when to, how to spot the signs when I'm kind of going into a depressive state or a manic state. And it's all been about kind of noticing the signs and talking to somebody. I think if you've got somebody to talk to and sort of let it out, it just helps you to understand what's going on in your own mind. And I guess the other thing for me was getting up on stage and being able to use my sort of experience with Miss England as a platform to speak about mental health and kind of show that it's not just about being sort of nervous or anxious as a person. You can't help it, it's wired into your brain, but you can deal with it, and it shouldn't stop you from kind of doing anything that you want to do. If you want to get up on stage, if you want to sing, or if you're a recording artist, you know, it shouldn't stop you from doing what you want to do. You've just got to learn to kind of deal with it, and that's what I've done with Miss England for the last few years.
Okay, so briefly, I've got a diagnosis of bipolar, borderline personality disorder, and a working diagnosis of PTSD. My mental health sort of started getting a bit different when I was about 8 or 9. That's when my mum picked up on it. I was really withdrawn. I didn't really like going out and hanging out with people. I was always really sad. But at the time, because I was so young and I didn't understand why I was getting sadness, I'd turn it into anger. For probably from the age of 8 until 11, I was the angriest child you'll ever meet in your life. Like, if the slightest thing went wrong, like I was tearing the place up. It wasn't until I was 11 I just broke down in front of my mum. I was just exhausted and being angry all the time, and I was like, please help me. And she was like, of course. So got anger management and got that all under control, and they helped me like learn that it was okay to be sad, and you don't always necessarily have to have a reason to be sad, and da-da-da. And then I was under CAMS until I was 14, and I had a really bad experience with them. I had a woman laugh at me, and so I just left, and then I went from 14 till 17 with no help. When I was about 16, when I was 17, I hadn't long turned 17, got put on fluoxetine because they thought I was just depressed. And over the course of the next few months, so with bipolar, if you're given an antidepressant without a mood stabilizer, that can be so dangerous. And my mood just went, and initially everyone thought it was great because Stevie was happy, this is a good thing. Then it kept getting more and more, and then I was manic, and then it turned into a psychotic episode. I was hearing things, seeing things. I tried to attack a woman that was a close family friend because in my head she was somebody else. Got real scary, and I was put into a psychiatric ward that night, and my first stay was 4 months, and then I was in and out for the next, from 17 till I was about 20. I think it was when I was, just before I turned 22, when I was like, can't keep doing this. I was on so many different types of medications. I was my hair was falling out, my skin was grey, I was still so ill, in and out of hospital. I just felt like nothing was changing. So I stopped looking outwards and I started looking inwards. I cut down all of my meds. I went from being on 15 different pharmaceuticals, and I'm now on 2. What I actually did was, the first thing I changed was I started practicing gratitude. That was my first form of self-care. So every day when I woke up, I'd think of 5 things I was grateful for, even if it was just simple things like a toilet so I don't have to go and pee outside, real simple things like that. And then I found the more I did that, the more I wanted to do it, the more it come naturally to me. And then I carried on with social media, and I was really trying to pump out decent content for people. I was trying to help as many people as I could, and I just burnt myself out, big time burnt myself out, and I just flopped, and I couldn't upload anything. I wasn't wanting to upload even to Instagram. And then that was when I sort of took a real look at myself and was like, oh, okay, you're putting everybody else before you, and you're giving out all of this information and telling everybody how they can help themselves, but you're not practicing any of it. And I realised that I was actually kind of just a really big hypocrite, because, it was always coming from a place of love and a place of wanting to help, but I was never really doing it for myself. So I said to all my followers and stuff, I'm going to have to just take the pressure off me for a bit and stop uploading, and I just need to work on myself. And since then, I've just, I took some time out for about the past year now, and I've just been doing loads of self-care, gratitude lists every day, putting myself first and learning to say no has been a massive, massive part. And then this year the aim is to get back into doing all the YouTube and social media stuff, now that I can put out, I feel like I can confidently put out, give people advice and stuff, and I can happily say now, I'm not being a hypocrite, I do this myself. So that's sort of my story.
This is going to sound like the opening of one of my blog posts, but I didn't actually know anything about mental health issues until I was diagnosed with mental health issues. So I had a really traumatic childhood. I lost my mum when I was 15 to a heroin overdose, so it was out of the blue. And I I struggled a lot through my childhood and being put in foster care at quite a late age and stuff. So I knew that my childhood was going to affect my adulthood at some point, because when you go through stuff and you don't kind of deal with it, you know it's going to come back around. But I also gave my life to Christ when I was 16 years old, which was 17 years ago. And I always felt like, you know, God was going to just heal me of all these things that I was going through and was just going to like magic me better, which he can do. But what had happened when I turned 30 is I was really struggling with a lot of things. I was struggling to move forward in my life, and so I went to the doctors and genuinely said, when you turn 30, your hormones change, because like I'm a ranging hormone right now and I just don't recognise myself. And anyway, to the point, I got diagnosed with severe combined adult ADHD, which I didn't know existed, because obviously we're kind of taught that children get ADHD and the children that parents don't really discipline them properly. So I was diagnosed with adult ADHD, which is something that I obviously had as a child but didn't know. So it was hard because it's incurable. So I started thinking, okay, so 1 minute I'm feeling like God's going to heal me of all these weird ways I've got. But a lot of the situations that felt like were blocking me from moving forward were actually symptoms of ADHD, which include anxiety and depression, which I suffered with too. So life happened and lots of situations happened which probably increased the severity of my symptoms. So a lot of situations happened that caused me to be more anxious than the average person, and a lot of other things happened that made me go through depressive stages. But the kind of overlaying thing was that I was struggling with a mental health disorder or a neurological problem, a chemical imbalance that was causing me to not be able to operate in the same way as a regular person. So I started concentrating on ADHD and I learned loads, and I learned to understand myself, I learned to love myself. I understood what self-care and self-love was. I thought self-love was not hating yourself, and it wasn't. Self-love is being deliberate in making sure you put yourself first. Where because I suffered with eating disorders and stuff like that when I was younger, which a lot of young women with ADHD do suffer with, I thought that self-love meant that I'm not going to be wanting to attack my body weight-wise and stuff. But I learned that it was a lot more than that. And after about 6 months of blogging and teaching other people about ADHD, because I knew that there's no way that me as like the strong person I felt like I was to find out I had something that I didn't know existed. There must be other people, especially women who ADHD is kind of ignored in, that needed me to be that voice. So I went through my journal, which I've been journaling since I was about 12 years old, and I looked at journal entries that just sounded mad, like the ones where obviously ADHD was active, and I turned them into blog posts and started helping people a lot. But I found about 6 months in, I burnt out, exactly what you guys were talking about. I found that I couldn't manage my ADHD well. I was told that only medication would help me. There was no point getting talking therapy or behavioural therapy because I had 2 types of ADHD, so medication would be the only thing that could help me. But obviously watching loads of films and having loads of fears, there was no way I was going to take mental health medication because I thought it was just going to turn me into a cabbage, which is not true, but it was what I thought. At the time, I didn't have any knowledge about mental health medication, so I totally rejected the medication route and just did all this like advocating, changing my diet, changing my way of thinking and stuff. And then when I did finally get the courage and the patience to look up talking therapy, I found out, which is quite obvious, but I was also diagnosed with complex post-traumatic stress disorder, which is obviously dealing with several different episodes of trauma from childhood to adulthood. And obviously trying to manage my ADHD was going well, but there was trauma that I was completely ignoring, because when you deal with trauma you have to go back to the things that traumatize you, which hurts. And I was not on that. I was on just being productive and helping people. So I ignored all that stuff for a long time, and I'm just dealing with that now. So I'm going through a big healing process. I'm I'm humbling myself and becoming vulnerable for the first time in my big adult age, and I'm loving it. Like I'm enjoying the different ways self-care and self-love is manifesting itself to me as I open myself up to it. So I just hope if you guys just need any encouragement, or I just hope that I can do that and be that for you guys.
So, my story, I was in a group called Marvel. The cameraman actually stopped me. And they was like, yo, the shocker from Marvel, right? So I was in a group called Marvel, and like, was together for like 5 years. We did like so much amazing things. Like we toured with Chipmunk, we toured with Diversity, we toured with Skepta, and in end of 2011, I actually had a breakdown and I ended up getting sectioned. And that happened, now looking back on it in hindsight, it happened because of the pressure that I was putting on myself at that age, because we lost our deal, everything just went pear-shaped at a point. And I realized like, I was like ego-driven at that age. Because when you're young, I'm thinking like, everyone's gonna be judging me because I lost my deal, my friends are looking at me, I haven't got no money, it's just things that we go through. And then, so they diagnosed me with manic depression, and then I got sectioned again in 2014, then I got sectioned again in 2016, and they diagnosed me with schizophrenia. So I got sectioned 3 times. And then I'm a kind of person where I'm good at looking back and seeing what I need to change. And I think that's important. Sometimes we repeat the same cycle like over and over again, but there comes a point where you've got to stop and be like, where can I change things? And like, one of the things that was happening to me was that the doctors used to always tell me, don't come off your medication, come off it gradually. I used to come off it straight away. Did you do that too? And then the doctor used to always tell me, don't come off your medication, Kenneth, I'm telling you, come off it bit by bit. But like, and another thing that helped me so much is that I accepted it the 3rd time. That was the difference, because I'm looking back on it now and I'm like, what really changed? Like, what snapped in me? But I realized the 3rd time, I actually accepted it. And I said, okay, cool, I do. Because another thing that was hard for me to accept is that what you said about not having an idea what mental health issues is in the first place. I didn't have a clue. Like, there's 3 people in the crowd that know me from when I was young. I was oblivious to mental health. I used to see it as everyone else saw. I used to see someone and think, oh, he's crazy on the street. Do you know what I mean? I used to laugh, like, oh my God, now it's even worse than this viral era because they actually record the person. Someone sent me a video the other day of like, someone having an episode and there's kids were just recording him, laughing him. But I understand it from both sides. I understand the guy having an episode, because I've had an episode, and I understand the kids that don't have no knowledge about it. So they're just seeing it as like, whatever it is, they don't have no information on it. But, so it was hard for me to accept. I was thinking, if you think about the position that I was in as an artist, and the things I've done, in my mind I'm thinking, nah, this can't be happening to me. And I was in a group called Marvel as well, which is ironic, so I thought I was like a superhero. Do you feel me? So I was thinking, nah, I'm a superhero character, this can't be happening to me. But like, it's good that that happened because it opened me up to like human experiences and things that human beings go through. I was oblivious at that time. Now I'm kind of grateful that I went through that situation, because I can sit here now and I can talk to you about things that human beings go through on a day-to-day basis. And like, one of the things that helped me was accepting it. The second thing that helped me was gratitude, what you said. Gratitude is actually a superpower. People don't realize that as long as you're not dead, you've got something to be grateful for. On January the 1st, literally New Year's, I sprained my neck. I was in my bedroom, listen, I'm not even safe in my own house. Like, usually you think, oh, I don't want to go outside and get in trouble. I sprained my neck at home. I was in my bedroom, and like, I've got this stupid habit I do. Thank God I stopped it now, so maybe that's why I had to sprain my neck. But I've got this habit I do where like, I push my neck forward, it's weird. And I did it and I sprained my neck and I was like, oh my God, this doesn't feel right. And then I ended up in the hospital January the 1st, New Year's, and I was like, imagine that, like just 10 minutes ago, I was literally dancing and chilling in my room, and now I can't move my neck. And like, everyone in here, please like move your neck left to the right, yeah? And appreciate that shit. Like, and that's like, now when I'm on the train, before I used to be embarrassed to like, dance along to my music on the train because I didn't want no one to look at me. Now, I don't give, can I swear? I don't give a fuck. Like, I appreciate my neck so much. I'm fucking so hard. And everyone's looking at me like, I'm like, you don't even know my story. So it's like gratitude is actually a superpower. The fact that your legs is working, your arms is working, you can, when you master gratitude, you can flip anything on its head. No matter how bad your day is, you can always flip it and be like, but I'm not dead though, but my arms are still working, but this is, you can always flip it, and that's the key. Another key that helped me was getting to know myself. There's so much people walking around on this planet that don't have a clue who they are. And I'm not talking about your job occupation, I'm not talking about your grades, I'm talking about like our God-given identity. How does the Creator view us? Because because I got a song called Self-Love and he was telling me to talk about it.
Yeah, sing it.
And I got a song called Self-Love and like, the chorus goes, you give everybody else love, but you never give yourself love. Don't forget about your self-love. Self-love, and that's so important because I'm not saying on the song that I love myself the most. I'm saying that exactly what Elo's been saying. We give everybody else love and we forget about ourselves. So good to me is the perfect title for this show because it's like we're the last people we're good to. How? We spend all day with each other and we're the last people, like we're literally in our head every single day and we can't say kind things to ourselves. So it's like, getting to know yourself is so important. So I took time out, I took time away from everyone. We haven't seen each other in years. This is the first time I'm seeing you in years. I took time away from like everyone and I literally got to know myself, like the person that created this thing that I'm in, like how does he view me? I know how the world views me and how the world views me is what got me into this depression state in the first place. Because the world's not going to view us in a nice way. This is all business to them. If you learn how to love yourself, it messes up business. That means you might come out of some days without no makeup. You got to pay, them brands are going to suffer. You know what I mean? That means you can wear the same clothes like 3 days in a row and not care about people wearing. Them brands are going to suffer because you're not buying their brands. So self-love hurts the business. So I see why the world doesn't want to push it. I get it. So then I had to go to God and I had to go to the universe and find out how do you view me? And I realized the universe views us as perfect. Like we're completely loved. And that's why I had to make the song Self-Love, because what's going on in the world now is that our self-image is really low. And your self-image can become low from like different things, like what they all mentioned. Her mum passing, that's traumatic. Like the situation she's been through can make your self-image low. But how we raise our self-image back up is self-love. If we can love ourselves again, if we can appreciate ourselves again, we can raise our self-image up. And the reason why I'm stressing self-image so much is because your self-image actually determines how you perform in the world. If you view yourself as a bad luck person, as a loser, as an unlucky person, that's going to show in how you meet people. That's going to show in how you talk. That's going to show in how you greet people. Someone might ask you, hey, I've got an opportunity for you. You might turn it down because you think you're a bad luck person. So you just blocked out your blessing. So it's like, do you know what I'm saying? So it's important for us to raise our self-image, get to love ourselves. So yeah, I hope that helps.
Thank you so much for you all sharing your experiences, because I know how difficult that can be sometimes as well. But I liked the way kind of what I heard from all of you actually was an aspect of kind of a self-awareness where you were able to kind of take back that control. And I think having self-awareness goes hand in hand with self-care. It's important that we are able to be self-aware. And some of us might not know how we can do that. And one way that I preach that we can do that is just by simply checking in with ourselves and asking ourselves, how am I?
Exactly.
How am I feeling? What's going on? And just take some time to pause. We know how busy and stressful life can be. Okay, and sometimes we might go out to others to try and seek for that support and that care, but we can actually do that for ourselves. So the things that you would probably do with a friend, where you would probably, ask them how they're doing if you can see they're a bit stressed or they're not in the mood, etc. You can do that for yourself. So that's also another way of also developing that relationship with yourself and eventually building that self-love. So self-care, self-love, they all kind of go hand in hand. So it's about taking the small kind of steps to eventually get there. It is a big thing and it is a journey. That's another thing. I like to say that self-care is definitely a journey, because there are bumps in the road and there are times where, you know, we might catch ourselves and find that we are kind of, you know, our self-care, self-love's not so great, but it's about what are the things that you can do to build that back up again.